Dr. Allison McGeer is an infectious disease specialist from Mount Sinai. She is on special assignment to research COVID-19. Dr. McGeer, thank you for taking time to speak with our audience again.
Pleasure to talk to you, always.
You are a veteran at this. You contracted SARS in 2003 when it infected 375 Canadians. Now, though, we have something even more contagious. How much worse are you expecting COVID-19 to get in Canada?
So I think, what we're talking about at the moment is that we cannot stop the spread of this infection. Because we can't stop it, we can expect over the next period of time, and that may be shorter or longer depending on our actions, that quite a large fraction of Canadians are going to catch it. We're trying to delay it now for two reasons. The first is that the further we get into it, the more work we do, the greater the chance is that we'll find drugs that can treat it, drugs that can prevent it if you've been exposed, vaccines, so that we'll be able to protect people better, either prevent them from getting infected or reduce the burden if they do get infected. So that's one thing. And then the second thing is that we know that if we just allow this to continue to spread the way it would normally, that we're going to have a very large number of sick people very quickly, and that's going to overwhelm our healthcare system, and then we will not be able to take care of those patients adequately, and we may not be able to take care of other patients in the system adequately. So the goal is not so much to reduce the total number of infections as it is to spread it out over time.
Okay, so testing for COVID is limited to travelers with symptoms and high-risk people. Is that adequate right now?
Well, it's what we have right now. So I think we'd all like more testing. But the problem, of course, is this is a pandemic. So everywhere around the world, everybody is trying to do a lot of testing. And to do that testing, you need supplies. You need the nose swabs. You need all the bits and pieces of laboratory equipment. You need the people who are trained to do it. And everybody's scrambling to try to share things globally. Okay, so we all want to be able to do essential testing around the world, and across Canada, labs are shipping swabs back and forth and equipment back and forth and moving things around to try to get as much as we can. So it's not that we don't want to do more testing. It's that just at the moment, globally, we can't do all the testing we want to do. So we're trying to make sure that we focus it in the areas that are really important. But there will be more, for sure, there will be more testing available as we get further through this.
Okay, wash our hands, self-isolate, social distancing, closing schools, businesses, recreational facilities, sports venues, basically everything. The virus is still out there. What's next in our behavior to curb this?
So the goal now is to really slow down the transmission dramatically. So once it starts, you want to say, okay, we're doing everything now, and of course it's not quite everything, because what we're doing is maintaining essential services, trying to keep as much as we can going. So what public health has decided to do is to say, we're going to create as much social distancing as we possibly can for the next 2 weeks. Once we get the transmission slowed down, under control, then we're going to sit down and say, okay, what can we release? What additional things can we do that we think are safe? And I think there's going to be a period of time after our 2 weeks when we're talking about, okay, we can do these things, but not these things. We can,
And doctor, there are still people working. Okay, we've got banks, we've got construction workers, frontline medical workers required to work through this. Is it easy to catch this virus if all those protocols are being followed?
Oh, yes. Yeah. So we know that we can slow down transmission of this virus. There are a lot of questions about how much we have to do to slow it down. We can't stop it, but we can dramatically slow it down. And that's been demonstrated in Singapore and in Taiwan and in South Korea. who had a bigger outbreak, but now have it slowed down. So we know we can slow it down. We're just talking about how much we have to do to get it to slow down, and how slow we need to have it in order to be able to continue to deliver care and to take the best care of people who get sick.
Okay, so now let's talk about the food supply. Grocers still assuring us that there's lots of food in the supply chain. Restaurants are closed, but we are being told we can order and take out, but not gather together, of course. What about the food preparation, delivery services? What about food prep and coronavirus? Can we safely order food for pickup and takeout?
Yes, to my mind, we can definitely safely order food for pickup and takeout. Certainly the food is safe, but remember that the majority of people are not ill. Everything about this is about assessing risk. We can't get the risk to zero, but we can get the risk low enough. And there's two pieces that protect you with takeout food or pick up food. The first is that transmission of this virus through fomites, okay, on surfaces, equipment is not very efficient. The most efficient way that this virus is transmitted is directly from one person to the next person. So me standing beside you, me touching you, me breathing or coughing on you.
Okay.
So transmission of fomites not as efficient. The second thing is, of course, you can always clean your hands, right? So you pick up food, you take it out of its containers, you put the container in the garbage, you clean your hands before you eat it. Your mother told you always to clean your hands before you ate, and that is what we should all be doing.
All right. Dr. McGeer, you have had your own job change. You are on special assignment now to research COVID. We have a faith-filled audience. We're a faith-filled broadcast team. We're going to pray that your work is successful and that researchers like yourself get to the next steps needed to combat this disease.
And I thank you very much for that. This is, at the moment, for those people who are ill, a difficult and for many people and families, a tragic illness. And like you, I am both working hard and really hoping that we will be able to deliver better treatments, better prevention, vaccine mechanisms so that people don't have to continue suffering with this.
All right. Infectious disease specialist Dr. Allison McGeer from Toronto's Mount Sinai, thank you for joining us again.
Nice to talk to you. Take care.
Thank you for liking, commenting, and subscribing. What do you think about today's topic? Let us know in the comments.